Video opens with a friendly doctor in a clinic setting, smiling at the camera. Soft, reassuring music plays in the background. Hello and welcome. Today, we're going to talk about something incredibly important for your health: the HPV vaccine. There are a lot of questions out there, and it's completely normal to want clear, straightforward answers. So I've gathered the 10 most asked questions about the HPV vaccine, and I'm here to answer them for you, one by one. Let's get started. First question: what exactly is HPV? HPV stands for human papillomavirus. It's not just one virus. It's a very large group of over 200 related viruses. Some of them are called low-risk types because they might cause warts on the skin, like on the hands or feet, or in the genital area. Others are known as high-risk types. These are the ones we're most concerned about because they can cause serious health problems, including several types of cancer in both men and women. In fact, high-risk HPV is the main cause of cervical cancer. The tricky part about HPV is that it's extremely common. Most sexually active people will get HPV at some point in their lives, often without ever knowing it. Your body's immune system can clear many of these infections on its own, but sometimes the high-risk types can persist and lead to cellular changes that eventually become cancer. That brings us to our second question. What does the HPV vaccine do? The HPV vaccine is a safe and effective way to protect your body against the most common high-risk types of HPV that cause cancer, as well as the types that cause most genital warts. Think of it like a training session for your immune system. The vaccine introduces a tiny, harmless part of the virus, a protein shell, with no viral DNA inside, so it can't cause an infection. Your immune system sees this protein, recognizes it as a foreign invader, and builds up a powerful army of antibodies. Later, if you are ever exposed to the real HPV virus, your body will already have these antibodies ready to fight it off immediately, preventing the infection from ever taking hold. It's a proactive way to stop the problem before it even starts. Question number 3 is one I hear a lot. Who should get the HPV vaccine? The recommendation from health organizations worldwide is for the vaccine to be given to preteens, both boys and girls, at age 11 or 12. The reason for this timing is crucial. The vaccine works best when given before a person has any sexual contact and is exposed to HPV. Research has shown that younger adolescents produce a stronger immune response to the vaccine compared to older teens. This means they get more robust, long-lasting protection. However, the vaccine is also recommended for everyone up to age 26 if they weren't vaccinated when they were younger. And for adults aged 27 to 45, it's a good idea to have a conversation with your doctor. If you're at risk, you might still benefit from getting vaccinated. So it's a decision you can make together based on your personal health and lifestyle. The fourth question is about timing. Why is it recommended so young, for 11 and 12-year-olds? This is a great question. It gets to the heart of how preventive medicine works. The goal of the HPV vaccine is to provide protection long before there is any risk of exposure. We want the body's defenses to be fully built up and ready. Giving the vaccine in ages 11 to 12 ensures that children are protected years before they are likely to become sexually active. It's about preventing a future problem, not reacting to a current one. Plus, as I mentioned, the immune response in this age group is incredibly strong. Getting the vaccine at this age often means only 2 doses are needed, whereas older teens and young adults require 3 doses to get the same level of protection. So, it's both more effective and simpler. Number 5 on our list. Is the HPV vaccine safe? Yes, absolutely. The HPV vaccine has an excellent safety record, backed by over 15 years of monitoring and research. Billions of doses have been given worldwide, and scientists have studied its safety extensively. Like any vaccine or medication, it can have side effects, but they are typically very mild. The most common ones are pain, redness, or swelling where the shot was given, similar to what you might experience with a tetanus or flu shot. Some people might feel dizzy or faint after any vaccination, including this one, so it's recommended to sit or lie down for about 15 minutes after getting the shot. Serious side effects are extremely rare. Major health organizations, including the World Health Organization and the Centers for Disease Control and Prevention, all agree that the benefits of the vaccine far outweigh the risks. Question number 6. How many shots are needed? The number of doses depends on the age at which the vaccination series is started. This is based on how well the immune system responds at different ages. If the first dose is given before the 15th birthday, only 2 doses are needed. The second dose is given 6 to 12 months after the first one. This 2-dose schedule is just as effective for this age group as the 3-dose schedule for older individuals. If you start the series on or after your 15th birthday, you will need 3 doses to be fully protected. The schedule is typically the first dose, a second dose 1 to 2 months later, and a third dose 6 months after the first one. It's very important to complete the full series to get the maximum benefit. The 7th question is a practical one. If I'm already an adult, is there any point in getting vaccinated? This is an important conversation to have with your doctor. If you are under 26, the answer is a definite yes. Vaccination is still strongly recommended because you may not have been exposed to the HPV types covered by the vaccine yet. For adults aged 27 to 45, the vaccine may offer less benefit because there's a higher chance you've already been exposed to some HPV types. However, it can still protect you from the types you haven't encountered. Your doctor can help you weigh the pros and cons based on your personal situation. For instance, if you have a new sexual partner, you might be at risk for exposure to new HPV types, and the vaccine could still be very beneficial. Number 8. Does the vaccine protect against all types of HPV? The current HPV vaccine, Gardasil 9, is designed to protect against 9 specific types of HPV. It targets the 2 types that cause about 90% of genital warts, which are HPV 6 and 11. More importantly, it targets the 7 high-risk HPV types that cause the vast majority of HPV-related cancers. This includes HPV types 16 and 18, which are responsible for about 70% of all cervical cancers, as well as many cancers of the anus, throat, vulva, and vagina. So, while it doesn't protect against every single one of the 200-plus HPV viruses, it protects against the ones that cause the most harm. It's an incredibly powerful tool for cancer prevention. Question 9. If I get the vaccine, do I still need to get screened for cervical cancer? Yes, this is a critical point. The HPV vaccine is a fantastic form of primary prevention, but it's not a substitute for regular cervical cancer screening, like Pap tests or HPV tests. As we just discussed, the vaccine doesn't cover all cancer-causing HPV types, so there is still a small risk. Regular screenings are designed to find any abnormal cell changes in the cervix early, long before they could ever turn into cancer. Think of it as having multiple layers of protection. The vaccine is your first line of defense, and regular screenings are your second. Together, they offer the best possible protection against cervical cancer. So please, continue to follow your doctor's advice on screening. And our final question, number 10. How long does the protection from the vaccine last? This is an area of ongoing research, and the results so far are very promising. Studies have followed vaccinated individuals for more than 10 years, and they show that protection remains strong, with no signs of weakening. The immune response created by the vaccine is very durable. Based on the data we have now, it appears that the protection is long-lasting, and at this point, booster doses are not recommended. Scientists will continue to monitor this, but the current evidence suggests that getting vaccinated in your preteen years can provide a lifetime of protection against the most dangerous HPV types. It's a truly remarkable investment in your long-term health. That covers our 10 most asked questions about the HPV vaccine. I hope these answers have helped clear up any confusion and empowered you with knowledge. Making decisions about your health is important, and having the right information is the first step. The HPV vaccine is one of the most significant public health advancements of our time, offering a real chance to prevent cancer. For more reliable information on this and other health topics, be sure to subscribe to Sex Education Repo.